is the hydrostatic pressure of the fluid. So in this, we have, the whole thing is a membranous labyrinth, sits within a bony labyrinth. This area and this area together are called the vestibular complex. And the vestibular complex has two parts to it, the vestibule and the semicircular canals. The semicircular canals, the anterior, posterior, and lateral, but all you have to know is semicircular canals. And then at the base of each one of them is an enlarged area called the ampulla. And within the ampulla, it doesn't show, but within the ampulla is where you have the crista, the hair cells that sit in the cupula, the gel. And these are for, think about it, these are for rotation. If you're going this way or this way or this way, so they pick up rotation, also called dynamic equilibrium.
Okay.
So you can interchange those. This is just the overflow of endolymph. This is the vestibule, the utricle and the saccule, and then within those we have hair cells. But now they're within a structure called the maculae, and the maculae has the otolith sitting on top, the gel with the calcium carbonate crystals on it. And so now it registers gravity going up and down an elevator, linear acceleration, or if you tip your head. So those are all together for equilibrium. This one is called static equilibrium, and these are dynamic equilibrium or rotation. Okay. Then this is the cochlea, the cochlear branch of the vestibular cochlear nerve, just a little bit of the vestibular branch coming from these. And so inside it, we have the turns of the three tubes that are aligned together. So the pinkish one is the one on top, is the scala vestibula, vestibular duct. The blue one is the cochlear duct, and the green one underneath the basilar membrane is the tympanic duct or scala tympani. And then if I'm going to ask any of that in more detail, I'm going to go to that slide of the cochlea that you all drew and turned in. Okay? But I have opened this up and asked these.
And
Okay.
actually, we had some confusion because when we compared like the orientation for this and what we have in the diagram,
Yeah.
it looks like the opposite. This one looks like the
It
vestibule.
is. Well, look at this is going to be, if you look at these, the orientation, oh, I got to turn it this way. The orientation of this one is the opposite of this one. So it just depends which side it's on. So you'll get mirror image.